Dr. Jones, I'm going to start with you. Right now the estimate is that 1 in 8 women in the U.S. will develop breast cancer at some point in her life. So where do we stand today in this fight?
So where we stand is it takes us as physicians making sure that we can educate our population and our patients regarding the need for doing self-breast examinations and the importance of mammography screening. And this being Breast Cancer Awareness Month, this is the perfect time and opportunity to address that. Those statistics are high, and we need to reduce those numbers.
Yeah, Dr. White, I kind of think of it almost as like a checklist of the things that we need to make sure we're doing. And of course, early detection, 20% of breast cancer happens before the age of 50.
Absolutely. It's so important that women know about their personal risk of breast cancer, know if they fall into any high risk categories, and are empowered to speak with their clinicians, have access to the necessary screening tests so that if cancer developed, it can be found at an early stage when it is highly curable.
I also want to talk, Dr. Jones, a little bit about women understanding, what to look for. What are the signs? What kind of things, at home should we be aware of?
So some of the things to look for is any changes that may occur in their breasts. We know our breasts because it's part of us. It is important that we understand any changes, if there's any kind of redness, if there's any kind of discharge coming from the nipples, if the nipples tend to invert in, if there's any scaling around what's called the areola, which is the darker part around the nipple, if there's change in skin texture, if there's any lumps that you feel that's out of the ordinary, if there's any kind of bleeding that may be noted, those are some of the signs and symptoms that are important for people to look for.
And Dr. White, I know that, obviously people talk about, getting your mammogram, but there are other screening tools, especially if you have dense breasts.
Yeah, so I think the foundational test when it comes to screening is the mammogram. That is the test that we know has the best ability to detect breast cancers, but it's not a perfect test. And particularly for women who have dense breasts, a mammogram has less of an ability to pick out the abnormality within that kind of screen of dense breast tissue. And so for women who do have dense breasts, the addition of a breast ultrasound can be very helpful and increase the accuracy of screening.
And let's talk about, unfortunately, obviously, we've been through a time where a lot of people have, been hesitant to go to their doctors and to get their yearly checkups, Dr. Jones.
COVID-19 did a whammy on a lot of our patients. They're afraid to go, but it is so important that we reach out and make sure that they know it's safe. Our facilities are safe for them to come into, and as well as our doctor's offices. So it is important that they reach out and that we get the patients to come in, because again, as you know, breast cancer is one of the leading killers among women. And people also have to know that breast cancer doesn't only affect women, it can affect men as well, 1% of the population.